Hi guys, and welcome in today's session. In today's session, we're going to talk about lateral epicondylitis, or also known as tennis elbow. So tennis elbow is an inflammation of the tendon of extensor carpi radialis brevis, or the tendon of the muscle that does this movement. So from flexion, it brings the wrist into extension. And the insertion of this tendon is in the lateral epicondyle, or where we feel that pain when we have tennis elbow. There is quite a few tests that you can use for this, and I'll show you to you right now. So the first test we can use for it is a simple wrist extension against resistance. So from here, you're going to try to do this movement with your wrist while you're applying resistance. And if that recreates your symptoms, then that is a positive test. Another test is that you simply stretch your wrist down while your elbow is straight. So you do need your elbow straight for this test, and if there is some pain in the lateral epicondyle, then that again is a positive test. So once you're sure that you have it, what do? So initially you will go to your doctor and he might prescribe you rest or he might prescribe you anti-inflammatory drugs or painkillers, and these are all good options. But it's very important to understand why lateral epicondylitis happens, and it's because of overuse injury or because you're putting extra load on your tendons and you do not have that strength for that load, right? So that's why it's important to change your routine. So if you're playing tennis every day and you're having this problem, then you have to stop for a while and allow the time to heal for your tendon. Or if you're doing some different duties in your job that are requiring you to lift and carry around heavier weights than normal, then again, you need to stop and you need to rest for a period of time and to allow healing. Another thing that you can do after rest and medication is a tennis elbow brace. This is a brace that you're usually going to put around 2 inches below your elbow crest. This is the area. And it's very important that it's not over your elbow or down in your wrist. It really needs to be around 2 inches below the elbow crest, because in that way it can shift some of the load that you're trying to put through your wrist into the brace itself, not allowing it to reach the lateral epicondyle. Now, another thing that you need to understand about tennis elbow is that actually is a dysfunction of your wrist. Is this movement that is causing that pain. So it has nothing to do with bending your elbow. So when we start rehabilitating it, we need to do, okay, range of motion for the elbow. Sure, you can do flexion, extension, you can do pronation, supination, but you also need to work with your wrist. And there's a certain type of exercises which are called eccentric muscle strengthening, when the muscle is working in a lengthened position, that are the best exercises for this scenario and also for all tendon problems. So let me show you how that looks like. For these exercises, I'm using a 1 kilogram weight, although I would strongly advise that you start with 0.5 pounds, since there's a lot of pain and swelling when you have an acute stage of lateral epicondylitis. Now, what I'm doing here, I'm simply bending and straightening up my wrist against resistance and against gravity. And I'm doing this exercise very slowly. Now, you need to understand that the strengthening process happens exactly when I'm dropping my wrist down. And this movement needs to be very slow for it to work. The next movement is the opposite movement. We're basically flexing and extending our wrist against gravity, and here the extension is very slow. So you don't want to just drop your wrist, but instead you want to control that movement. You usually want to start with about 10 repetitions of each exercise, and if that creates any pain, just stop. If it feels like too many repetitions, again, just stop and take rest. The next exercise that you're seeing is the ulnar and radial deviation. So here we're simply bringing our wrist up and down. Again, it's very important to control the movement and don't let the wrist drop. Now you can also do this exercise differently by having your hand in a different position and simply going towards the right and towards the left. And here we're eliminating gravity. You again want to do about 10 repetitions. If 10 repetitions feel like too much, then just do 5 repetitions. Now we're going to do a combined supination and pronation of elbow and wrist, and we're simply twisting our hands towards the left and towards the right. And again, you want to make sure that the movement is controlled. So you want to do 10 repetitions of all these exercises about 2 to 3 times a day initially, and then you can increase to 5 sets of 10 repetitions every day. You want to make sure that there's no pain when you exercise, because that can cause further damage to the tendon. Another component that is really important in healing tennis elbow is stretching. Like initially it might be very painful because this tissue is damaged, but over time, as you start to do the eccentric muscle exercises, as you start to do like the rest and also the periods of break from your everyday activities that are causing the pain, you might start with a stretch. Now for the stretching, you simply are gonna bring your wrist down while the elbow is completely straight. And you want to stretch to the point of no pain. I don't want this to be very painful. I don't want it to be uncomfortable. Just tiny bit of a stretch. And then you can work with that range of motion. So if one day you can be here and then the next day you can increase your stretch little by little so that it's not painful and traumatic for the tendon. Also, you can do the opposite stretch to keep the antagonist or the opposite muscles also lengthened. You want to stretch around 30 seconds and do it around 3 to 5 times a day. Of course, if you do have any pain in any of the above exercises, you should stop and rest until the pain is gone. Thank you so much for watching and have a wonderful day.